All right, I'd like to call the Committee of the Whole meeting for September 14th. Now the mics are off, I think. They on now? On now. Before we proceed with the meeting, I'd like to recognize some new faces. On the trustee side, we'd like to recognize student trustee Jacob Howe from Athens District High School. Welcome.
Thank you.
Director, you have some new faces at the table.
At our senior table, some new faces around the table. Val Allen, who's come to us from All Points East, and now living in Maitland, of course, near me, so it makes it very popular. Welcome, Val, to the table, and already running in the new assignment. And Victoria Hemming, who's joined us from All Points South, but originally worked for the board at TIS 20 or so years ago, and is back at home, and welcome both of you to the senior table.
All right, Director, would you like to proceed with roll call?
Trustee Buckland, I think, is going to be on the line with us. We're waiting. No. Trustee Kirkner?
Present.
Trustee Garrow? Present. Trustee McPherson? Present. Trustee McAllister? Present. Regrets, Trustee McDonald. Trustee McMillan? Present. Trustee McRae? Present. Chair Petersman? Present. Regrets, Trustee Richards. Trustee Swan? Present. And Student Trustee Jacob Howe?
Present.
All right, look for a motion to approve the agenda. Mover and seconder, Trustee McRae, Trustee McMillan. All in favor? That carries. Any declarations of conflict of interest? Seeing none, I'll move on to the report from private session. During private session this evening, one property matter and one contractual matter was discussed. Approval of minutes, regular meeting June 8th. Are there any errors or omissions? Seeing none, I have Trustee Kirkner moving, seconded by Trustee McAllister. All in favor? Opposed? That carries. Great. This is a much anticipated presentation, much lauded by previous reports from SEAC. And so we're very pleased to have Dr. Jim Sophia and Dr. Allison Inglis here, and I'm going to ask Susan Edwards to introduce them.
Thank you, Chair Petersman. Yes, it's indeed my pleasure to introduce our two chief psychologists, Drs. Inglis and Sophia, Dr. Allison Inglis and Dr. Jim Sophia. Trustees, you've set the benchmark for the board by which others are measured, and we have two of the finest chief psychologists and the most knowledgeable chief psychologists throughout Ontario. And tonight they're here. They gave a very good presentation to SEAC and our community members, and they're here tonight to give a presentation on working together to promote mental health. And they're here to discuss how the T4L student engagement team works with schools and works with our community partners throughout our board to serve and wrap around care and support around our students. So it's my pleasure to introduce Dr. Jim Sophia and then Allison.
Allison will follow me. Thank you very much. Thanks for inviting us. So tonight, Allison and I are going to speak about how we as a system, including student engagement staff, work together with our community agencies to promote the mental health of our student population. Now, the top of this pyramid represents all Upper Canada students who are schooled within a system that actively promotes, among many values, character always, the principles of CREW, for which W stands for wellness, as you know, mutual respect, safety, inclusion, putting the needs of our students first, instructional leadership and excellence, for which our principals play a key role. These messages have often been communicated, shared, modeled, and reinforced. And I'm very proud to say that I often see fine examples of such practice in our schools throughout the system. The promotion of mental health and the prevention of mental health disorders begins at this broad level. Now, the inverted pyramid on the left, if you can see it, represents us and how we promote mental health by our shared vision, beliefs, goals, and practices, which affect all students. Now, I'm going to speak about the role of student engagement staff in the area of prevention and intervention. And I hope that you'll note that the role that we play in prevention and intervention complements the role of and the work of our community agencies by ultimately filtering out and identifying those cases at the bottom of the pyramid that truly warrant the attention of our community partners, who, as you can see, play a major role in the practice of intervention. Our collaborative relationship is mutually supporting and beneficial. So let's start with our student engagement staff, and let's start with psychology. Our psych staff. So what does our psych staff do? Well, most individuals would say that our psych staff conducts psychoeducational evaluations. Well, they do, but they also do more than that. And that's because assessment does not begin with a psychoeducational evaluation. It begins in the classroom with a regular classroom teacher observing learning and/or instructional challenges, and then collects information from a wide variety of sources to basically ask the question, what is going on? Now, this endeavor is also supported by a model of collaborative inquiry, which asks the same question. What is going on? What is truly mediating the learning of a particular student or groups of students? Now, this endeavor and this information is really ripe for SSTs. Every teacher can bring this information, the information that is collected from observation regarding learning or behavioral challenges, can be brought to an SST where the teacher would have the benefit of interacting with their peers, administration, student engagement teachers, and also student engagement involving our psych staff, because our psych staff, in addition to testing, also serve as consultants and have valuable input into this process. Now, the purpose of an SST, or Student Success Team meeting, basically is threefold. It's to collect valuable information, it's to work as a team to evaluate strategies that occur over time, and to have an opportunity to collect data and review student progress. And I hope that you'll find and you'll see that the function of an SST also serves as a mechanism for prevention and early identification, in the same way that I discussed previously, the way we work with our community agencies. And in terms of our psych staff, one of our requirements is that an SST process occur regarding the student, so that important information is collected ahead of time, and there's an opportunity for the school to try new approaches, and also for psych staff to have an opportunity to serve as consultants if they're called upon to do so. Now, if we're going to apply the goal of 90% seriously, and we have, in addition to requesting an SST, Allison and I have openly stated and have agreed that we're going to prioritize referrals, which most likely result in a revision or an upgrading of instructional practice. So the bottom line is this: does the primary referral concern ask us to direct instructional practice in a way that will ultimately be documented and revised on the student's IEP? So that bullseye that you're looking at, what that stands for is increased student engagement and increased student achievement, and that is our goal. A number of years ago, with respect to psych staff, Allison and I conducted a review. We asked our consumers, who were our principals, our teachers, our parents, what do they want from our psych reports? What do they value about our work? And I'd like to share with you very briefly some of the findings. What we learned was that they continue to appreciate the use of graphs and charts in reports because graphs and charts augment comprehension of the findings. They also appreciate concise language with less jargon. They also appreciate, with respect to formulating the IEP, that a list of strengths and needs be identified and placed in the report to then be transposed to the IEP to be put into action. When we look at psych reports, we're sometimes mesmerized about all of the findings and what it all means. But what we've learned is that when we write a report, it's extremely important to have clear links between assessment findings and program recommendations. And when we make our program recommendations, what is appreciated is to focus on a few key recommendations to take off from. So improving student learning is a protective factor that supports mental health. So in addition to assessment and consultation, you should also know that our psych staff conduct PD in the area of mental health. They liaise with our community partners, they participate in crisis intervention response teams, and they're involved in a broad range, mild to moderate to severe, degrees of mental illness and developmental delay. Now, closely aligned and related to the work of psych staff is the work of our speech-language services staff, which is comprised of 7 speech-language pathologists who clinically supervise the work of 12 speech-language assistants. And the thrust of speech-language services is early identification of students at risk of academic failure by focusing on the 2 main correlates that support early literacy, and that is oral language development, fluency and articulation, and phonological processing skills. Briefly, phonological processing skills means the ability to auditorily discriminate, identify, and blend phonemes. And these processing skills, these phonological processing skills, are important building blocks to successful reading. It's extremely important that we get parents and teachers on board with respect to these important language goals, because ultimately what we would like to be able to do is to have all of our students crack the code. And as you know, letters, words are merely symbols which, when decoded accurately, unlock meaning to the reader. And that's where the excitement and enjoyment of reading begins. Our SLPs, as I stated before, have a caseload of students, and they clinically direct the SLAs, speech-language assistants, who provide language program to a caseload of students. They're involved in We Talk and Smart Inclusion, just as 2 important components of their work. And they also work with a broad range of mild, moderate, mostly moderate to completely nonverbal students. So these are the students that, because of their communication deficits, would profit from an activity such as Smart Inclusion. Now, some of you may be asking, well, what is really the link between speech and language services and mental health? Well, students are empowered by the service in the form of student achievement and improved literacy, but also students with very severe difficulties get a sense of belonging. They really develop a sense of belonging with respect to some of the contributions of smart inclusion. And we can go into that a little bit later if you'd like us to explain smart inclusion. But basically, it enables students to interact with others by the use of assistive technology. This is a long, this is a finding that's been in the psychological literature for many years. And there is definitely a connection with speech-language services here. Frustration leads to aggression. And for many of our LD, developmentally delayed and autistic students, they don't have the adaptive communication skills. And as a result, aggression becomes the most efficient way of releasing tension. So our focus with students with severe communication deficits is the teaching of adaptive communication skills, which is also augmented in really severe cases by the use of assistive technology, which narrows the learning and communication gap with these students. Okay, I'm now going to turn the presentation over to Allison, who will be discussing behaviorist and special service counselor staff.
So, wait, am I just pressing this button here?
You know what?
There we go. That's good.
You can
All good.
also use this.
Okay.
Yeah.
Okay. So we have two other teams that Jim and I work closely with, behaviorists and special services. We'll start with behaviorist staff, and like our other student engagement staff, behaviorists, we have 11 of them, are involved both with, I would say, prevention and promotion and intervention activities. And the promotion and prevention area are activities or approaches that are necessary and good for all students, including those who are at risk now or may become at risk in the near future. These are foundational programs. I mean, Jim referred to some things like character education. These are foundational programs that set the stage for pro-social behavior, promote social-emotional development, and thereby prevent social-emotional challenge. And social-emotional challenges are barriers, present barriers and impediment to learning. So when we talk about promotion and prevention activities with behavior staff, we're referring to the work that they would do. If you remember the pyramids that Jim was presenting, these are universal programs presented to everyone at what we refer to as Tier 1. These are Tier 1 activities. Now, intervention are more concentrated programs, individual tracking of specific students, some of whom may be receiving clinical services as well from community partners. Here we're referring to targeted and more individualized interventions at the Tier 2 level, and some work that may be included as part of Tier 3 interventions in partnership with other supports and agencies. If we look at promotion prevention, I always put those together, and we've got some examples here. I would also talk a little bit about early intervention. So we're moving from Tier 1 into Tier 2 activities through that span. Our behaviorist staff will consult with school staff on classroom behavior management for whole class or for targeted students at risk. That work is often followed by working with a classroom teacher to develop and assist in implementing a whole class or even a whole school positive behavior approach. We're really focusing on increasing capacity in our schools and empowering staff to understand and manage problem behavior, because problem behavior impacts mental health and it impacts learning. This staffing group participates in student success team meetings and case conferencing. They're often at the table brainstorming and providing input into strategies that can be tested and tracked for effectiveness. The response to intervention, the tracking of that is very important. And so they may work side by side in assisting school staff to do that work. They may be consulting with parents, in some instances with community agency staff, and they're consulting about often why a behavior is even occurring in the first place. What is driving that behavior? And that's the first step for any team in being able to develop methods and strategies, hypotheses, methods and strategies, to reduce or eliminate challenge. This group is also delivering programs that are directly associated with mental health, promotion, prevention, and early intervention, and they're delivering those programs in partnership with teachers to whole class in a school. So, for example, Friends, which is a program, a research-based program that provides students with skill building and good coping and reduces the incidence of anxiety and depression. They are also involved in something called Respect Ed, which is a Red Cross bully prevention and education program. And finally, this is the staffing group who takes the lead in training and certifying staff throughout our system in how to manage problem behavior using behavior management system techniques. This is a group that carries a large caseload, and at the intervention level, where we're talking now about Tier 2 and into Tier 3, targeted individualized interventions, they are working with staff as part of a team to develop behavior plans for targeted students who have ongoing behavioral concerns, again, to reduce the challenge presented by that behavior, while building skill in being able to operate on a more pro-social level. They're developing, as part of a team, safety plans for targeted and identified students who are presenting ongoing safety risks to themselves, to staff, and others. They're developing specific methods for behavioral intervention for identified high-needs kids, and I would include in that a functional behavioral assessment and using applied behavioral analysis approaches. They may participate as a member of a crisis intervention response team. So this is a team that provides a diversity of supports to schools, to staff, to students at all 3 tiers of that pyramid of interventions. If we move on to our special services counselors, last but certainly not least, we have 8 of these wonderful people. And the SSCs, as we call them, this staff deals almost exclusively with Tier 3 students. So these are students who've been identified with multiple challenges, not just mental health challenges, but other challenges as well, be they socioeconomic or otherwise. So they either have diagnoses or they're at high risk for emerging mental health issues. Having said that, this group does not just work at the Tier 3 level. This is a staffing group that also provides in-servicing to our school. You'll see checkered flags come up in a little bit. And many of that group are going to be providing training, for example, in violent threat risk assessment to staff throughout our system. This is a group that collaborates on behalf of our students, working with our schools, with our community agencies on an ongoing basis. So you'll see up on the screen, again, there's a very, very strong connection between our special services counselor staff working at Tier 3 and our community agency interventions. And they're really dealing with students who are affected by many of the things that you see lined up on the left. There's truancy, disengagement from learning, abuse, dysfunction, etc. So in general, the SSCs provide a multi-level service delivery to families, schools, and community, consultation, assessment, counseling, and referral to services, including mental health services. They function as social workers to families. They make home visits. They link families to mental health and other services. These are families who often need significant support to navigate systems, and that includes the school system. And so assisting families with that, with navigating those systems, helps ultimately keep kids connected to school, because that's the point, that's the work. We call these folks ambassadors when they're working with school staff, families, and agencies, and they work very much as part of a team, and it's in an effort to set realistic expectations and goals to connect or reconnect students to education, and it could be education in a regular school setting, alternative placements, mental health placements, etc., etc. These folks carry a very large caseload, and they're usually acting as a case manager in partnership with the school principal to coordinate services and options for kids. They're involved also in case conferencing with other board staff, parents, community, to share information and to set goals. They play a prominent role along with the chief psychologist during tragic events. They work with our community partners to provide mental health presentations in our schools. For example, they are part of a partnership with community agencies right now to go out into schools and to do in-service on the Checkered Flags document, which is a document aimed at educating staff about mental health and also how to enhance those local partnerships to meet the needs of students and families. And this is a group that's often consulted by other members of the student engagement team, especially when there are some red flags for mental health. In essence, this is a group that works to assist school and families to identify the barriers to successful school experience. And they work together with schools and families and other relevant services to reduce or remove those barriers so that children and youth re-engage in education. And a positive educational experience is a protective function when it comes to mental health. So this is a very active, busy, and dedicated team. So on that note, I'm hoping that what we've provided you with is not just a snapshot of our staff and who they are and what they do, and how they work together with schools, school staff, and community partners, but also is providing an overview of a tiered model of supports that recognizes the importance of promotion, prevention, early intervention, and treatment with respect to mental health and wellness and mental health problems. All of those tiers are important when we're talking about mental health. It's a model that helps us to think about and plan and situate our work in a way that optimizes learning and student success, healthy development, and really promotes effective, efficient program and service delivery. Thank you.
All right, thank you very much. Trustees, comments, questions? I'll invite both of you to come up to the mic to maybe answer any questions. Trustee Karkner.
They're out there through your chair to here. What supports are out there for the students who are gifted and are often found in stressful situations because of their own need to overachieve? Are there supports available for them, and how do you find these students, because they're not ones to come forward and show their stressors?
Well, yeah, both look at we do have a screening process where we hopefully, through the use of a very popular tool called the CCAT, identify some high-functioning students. However, we also have situations where we do test directly students using our own testing, identify students who are high achieving both intellectually and achievement-wise, academically. And really, each case is individual. So I think we could be identifying more gifted students, I'll be perfectly honest with you, and we really do have to look at that. But the students that we do identify as gifted, or the students who even come close to being identified as gifted, we take a look at their strengths. Some students who we identify as gifted also have a learning disability, and we have to juggle that, and that can be pretty difficult. But nevertheless, through consultation, we look at Bloom's taxonomy, for example. We try as best as we can to see if we can keep the student included in the group, but to provide some enrichment with respect to the level of activities that we assign that student or that we give that student. I think we could be doing more in this area. I think we do need to look at that. but nevertheless, from my experience, each case is very individual, and you know, we really look to monitor these students and how they function and how they work. And I know for me, that when I speak with a parent of a gifted child, I will have that parent keep in touch with me because, you know, being gifted can have its pluses and minuses, and we really need to be attentive to the needs of these students.
Yep.
I'm more concerned about the mental health of these students.
Okay.
These are our students they have.
You know, you're absolutely right. There are pressures, perhaps on some gifted students that we wouldn't see on other kids. We need to be aware of what those pressures are, absolutely, and recognize, as Jim said, that we often default to thinking that giftedness is a protective factor, when in fact it may be a risk factor. And so we need to just sort of really keep that in mind when we're working with any of our kids. We need to know for all of our kids what are risk and what are protective factors, and then recognize the signs of distress for any student. Okay, and that is something that we have to do work on, no question.
I want to thank you very much for having introduced us earlier to the three-tiered level of intervention, and I've seen so many references to it since then, and there are so many problems, whether they be mental health issues or not, that can be addressed using the three-level tier. On slide 10, Dr. Sophia, you mentioned there's a quotation at the bottom, improving, you said, improving student learning is a protective factor that supports mental health. Mm-hmm. Can it also be said that mental health is a protective factor that supports good learning?
Sure.
Obviously it does.
Sure, and I put that in there because students that are underachieving, as a matter of fact, if you take a look at the
Excuse me, can you just speak to the microphone? Thanks.
Right. Take a look at the bulk of students with behavior problems. A very high proportion of those students also has learning problems. And what I also tried to emphasize when I spoke about the speech-language services is that there's a direct connection between poor mental health and an inability to verbalize one's needs, okay, especially in young children who tend to have temper tantrums or tend to act out, mostly because they're not able to verbalize their needs. And so as a result, they just default toward getting angry. So student achievement and mental health do go hand in hand. And they do work together for sure, because if you're feeling good about yourself, if you have a positive sense of self, you're also going to have more energy to learn, and you're going to do a better job in school, and you're going to enjoy yourself, and you're going to enjoy learning. But you can also say that if you're an effective communicator, and if you are a higher achieving individual, that also affords you the status and certain attributes which contribute to positive mental health. So I guess you can, it's more of a reciprocal relationship, I would say.
I would be remiss if I didn't mention the fact that this board has formed a mental health work group to examine ways of better delivering mental health services.
Allison and I are a part of that.
Yes, well, as am I, although I missed that meeting this afternoon, for which I apologize.
Okay.
However, if you had a crystal ball, what would you see?
I'm going to have to turn that one over to Allison.
Would you really want to see from the improved delivery of services in our schools?
I was in Ottawa, Tim. I was in Ottawa this summer at some Geneva Center workshops, and I can't remember the name of the presenter, I'm not ever good on details, but she also was talking about the tiers, right? The tiered model of intervention is an oldie but a goodie, right? It's been around forever, adopted by everybody and his brother. So she was talking also about these tiered, and it was positive behavior supports in school. And the tier 1, they talked about, she had a little green line, so it went, green, yellow, red, right? So, red is when you're at tier 3 and, all the alarms are going off. And she talked about how much we need to grow the green, okay? Because the more we can set the foundation for optimal mental health and learning, the more we can sort of prevent or mitigate some emerging problems later on. And that means that down the road, literally down the road with our community partners, the kids who really need the help have been sifted and sorted and triaged and getting what they need. So in my ideal world, I would see us having a huge focus on Tier 1 and Tier 2, and really recognizing the importance of that. When we talk about mental health, especially out in the community, we do have a tendency to want more and more specialized treatment. And it would be akin to none of us ever were taught how to take care of ourselves physically, and all of a sudden we all need a cardiologist. Well, that's not very efficient. So what do? Public health puts big promotion on how to, good, healthy cardiovascular practices. And so the people who really, really need to get to the cardiologist, for whom that stuff doesn't work well enough, can get there. So I don't know if that's answering your question, but that's kind of where my focus is. But
and just to pick up on Allison's point, is that we really all own this. It's not just the psychologists or student engagement staff. It's really all of us, because we create the atmosphere, and that was the first couple of slides. Crew, respect always, character always. These are very important values that are promoted, and it does sift down, and it is a preventative way of helping students who are just on the borderline to do well, and we all own it, meaning that if we see that there's an issue, that we can speak about it, we can call attention to it. So I think all this publicity about the importance of mental health is extremely good, because it really opens our eyes. So to me, in an ideal world, is that we're all attuned and we're all aware of how important it is, and we know what role that we can play. And we don't have to be psychologists to play that role. We can play that role as a parent, as a teacher, so.
Could I add one more thing to that? So I talked about risk and protective factors. Sometimes we all have risk factors, and sometimes we can't always address risk factors, or we can't address them in a timely manner, but it's much easier to build in protective factors. And so, also recognizing that we have to look at both of those things. And sometimes if you build in, that's resiliency. If you build in enough protective factors, you can, again, mitigate that risk. So.
So, through you, Chair, my question would be, so in terms of this prevention model and the 3 tiers that we have, how are we engaging parents in this? Because we can, do everything that we possibly can in our school, but unless they're engaged in the entire process from the get-go, it's not going to work. So that's my question. How are we going to get there?
I'm going to start with the director.
First of all, a very important point, and I think that's going to be one of the central pieces of the study group that your trustee McAllister's on, Val's chairing. You see, although we have put it out here in the open, and with this type of presentation, we're starting to have the important questions raised, like Trustee Cartner's, where we say some of our most at-risk kids are some of the gifted kids who see well beyond the black and whites and into the gray of the world. But we still have such stigma attached to the admission of mental health issues and even the admission of a community that may be at risk. And so one of the things that I think Val and the team are starting to deal with is how do we have a public campaign that takes this from the back room and puts it front and center. We all talk about the broken leg, and we talk about perhaps someone healing from cancer, but there's still a stigma attached to and less because of the Luke Richardsons and the people come forward saying these things happen. And this will be our ability now to take the stigma away and say, but, can we take this deeper? And so I'm interested in what our doctors have to say, because right now, from my perspective as a leader in the province on this one right now, there are several boards that are further ahead dealing with stigma so they can get the conversations with the parents, the real conversations. We have to get there, but it's a long way to go.
Yeah, I think the question that you were asking was how do we engage parents? And of course parents play a crucial role in the development of children. And one of the sources of information that we encourage teachers to tap into are the parents, okay? So if there is an adaptive issue going on, if there is a student who appears to be anxious or depressed or a bit aggressive, we definitely encourage teachers to tap into where the parent is at, what the parent sees, and to invite the parent to our case conferences when we have case conferences to discuss what are our strategies. And as you know, as part of the psychological services, a key piece of that is getting input from the parent with respect to what are their views on their child's needs. I think we certainly, to pick up on the director's point, we do need to look at stigma, because if a person is inhibited by their mental health difficulties, they're not going to participate in a case conference, or they're not going to come forward and speak to teachers about their issues. And so we need to develop that, in my opinion, our opinion, I think, to develop that trust and to extend a hand to them.
And stigma is often related to misinformation, and we just have to start educating people and talking about what mental health and wellness and mental health problems really are, and that's a community's responsibility. So, which is part of what we're trying to show with the two pyramids, that we all have a role to play in that. So parents have supports through us, but also supports out in the community. But certainly we need to address stigma through education, no question.
Trustee McPherson?
You talk about huge caseloads, and I just want to make a comment first. From first-hand experience, your staff is phenomenal. That's all I can say. But I'm just curious as to how many special services counselors do we actually have out there, given the fact you have mentioned a huge caseload?
I have numbers, We have 8 special services counselors, and they service all of our schools and alternative sites and involved in mental health placements.
Thank you.
Trustee Garrow?
Yeah, thank you, Chair. Through you, Chair. I guess knowing where our schools are within Akwesasne, our Akwesasne Board of Education, a lot of professional development has to occur, and just not to forget our teachers, our staff, and working with them, as partners in that, because again, we're feeder schools into the system, and so this is really worthwhile. It's needed. Thank you.
Director? And Trustee Garrow, that is both a private and a public outreach that we've been involved in, and our Teaching for Learning team through Ian, every single offering is offered to the board, but also we have actually taken it to the island as well as we're going through. Tim, I think we don't offer a single thing in our area that we do not take and share with our partners, and I think that's one of the reasons why we're moving to a 7-year agreement.
That's right. Thank you.
Trustee McRae?
So when you talk about these 8 professionals. Can you tell me, in terms of a caseload, how many people would they have on a caseload?
I have those numbers, just give me 1 second,
just-
because I looked at this today.
We're talking about a mucho number.
I need, can you just stay, I need you to speak to the mic. We want to hear every word you have to say.
We're talking about large numbers.
Okay, so,
There you go.
this, it's a bit difficult to characterize, so I hope if I lose you, just let me know. It's quick though. Our staff has a monthly tracking system. So in September, their first contact with a student is recorded, name of student, etc., and that's it, okay? So if we want more detail about student number of visits or whatever, we would go to the file. So that's how it's tracked. So the student name is entered at the first contact in any given month. The average number of students listed per month on a Special Services Counselor's caseload is 98. That's 98 students that they've had contact about. Any one of those students could have been multiple contacts. Okay? 5% of students on the year, when I looked across the year, appear on the list in only 1 month. Okay? So they may have seen a student once, or worked with a family once or a school once about the student, or it could have been more than once in a month, but their name only appears once. That's for 5%. 15% of students on their lists appear in 5 or more months. Okay, so they're coming up again and again and again, because these are really intensive, complex cases. And that means that 80% of the kids that they see, they're seeing over 2 to 4 months, multiple times, or multiple involvements. It might not be with the student per se. It could be that they've gone for a hospital visit or been to the family home or what have you. So it's really big, that's a big caseload.
And these students are often followed. The special service counselor will follow some of these students throughout their school career, which is understandable given the fact that if you have a multiple diagnosis, your needs just don't go away. They reappear or they manifest themselves differently depending on your level of development and the stresses and strains that accompany different aspects of your life. So these are this is a long-term commitment that our people make.
Thank you.
Any other comments? All right, well, thank you very much for your presentation. As we were told, it was very informative, and I think gave us all a better understanding of the level of services and the way that we deliver them at the board, so I appreciate that. Thank you.
Thank you.
All right, trustees, I have a request. I had discussed with Trustee McDonald, who, as you are aware, was not able to be here tonight, that if he could make himself available between some of the meetings he had, that I would try to move around the item about the Ontario Public School Board Association. So would there be any objection to us getting him on the line now and dealing with that item, and then he's going to hang on as long as he can? I'd just really like him to be here for that, since he is our director. Are there any objections? Okay, so can you... There weren't any, were there? No. You want to go ahead and get him on the line, and we will... the next item then will be a letter to... or potential letter to the Ontario Public School Boards.
We're sorry, your call cannot be completed as dialed.
Okay, everybody had a chance to read the
Welcome to Bell Conferencing Solutions. Bienvenue aux solutions de conférence Bell. Please enter your conference ID followed by pound. Thank you. Merci. The moderator has not yet joined the conference. If you are the moderator, please press star now. Please enter your PIN followed by the pound sign. You will now be placed into the conference. On vous transfère maintenant à la conférence.
David, are you there? He may have been kicked off. I know he was waiting.
Let's see.
So anyway, I've let him know that,
Sorry, Greg, I had you on mute there. I was listening to
David?
Yeah, I was listening to the webcast. Sorry about that.
Okay, all right. David, we've adjusted the agenda, and we're now at the item, the letter from the Grand Erie District School Board. So I'll just introduce it, and then maybe you can make some comments, and then we'll open it up to the floor for discussion, okay? So as this letter came to me the same day I forwarded it on to you, which was a couple weeks ago now, a week ago, and detailing a concern by the Erie District School Board that they thought that the OPSPA fees should be looked at, no, not that they should be looked at, should be decreased due to the fact that they have experienced decline in enrollment and I guess feel that they don't want to contribute as much. The whole funding issue around OPSPA has been an ongoing issue, and David, I'm sure our director, will speak to that. Over the years, OPSPA's budget has remained relatively the same. I think, in fact, they almost have the same budget that they did 10 years ago. They have had a funding freeze in effect so that nobody's paying more or less while they review it. So I'm a little puzzled as to why Erie would get out in front of this. We as a board have consistently been very strong supporters of Ontario Public School Boards. A long list of directors have advocated that at the directors' table that if you're going to ask OPSPA to do things, that you actually have to provide them the resources to do it. They have a very small budget for the tasks that we ask them to undertake. So when this letter, when I read the letter, I frankly was a little upset of the tone and thought that we might want to consider maybe demonstrating some support or some encouragement to OPSPA and maybe putting a letter out there similar to Grand Erie's that rather than decreasing, we ought to think that we should pay for what we expect OPSPA to do, and we all probably expect OPSPA to do more. But it's hard to ask them to do more in 2011 with the same budget they had in 2001. We certainly aren't doing that. Our budget has gone up by almost $50 million since I started, and we've declined 8,000 students, 6,000 students, so, you know, the money is there, and so, anyway. David, do you have any other comments?
Well, certainly, I echo what you said so far, Greg.
Can we just increase your volume there? Okay, try again, David.
I think I echo what you've said so far, Greg, and I certainly appreciate the comments you've made around the efforts that we've made so far through OPSPA, trying to encourage them to look at raising fees. It's very odd, I think, for some people to come into a situation and say we'd like to see more, but I think realistic as we are as a board, we understand that the needs of OPSPA are growing. We as member boards on an annual basis look at the key priorities and the key works of OPSPA, and boards constantly want to add to that. And I think if you know, in particular Grand Erie wants to see a reduction, we need to make sure what do those boards want to do without. And if we look at the works that OPSPA does, the services they're providing to us without fees, those are things that have paid huge dividends for us, whether it's through labor relations issues and just ongoing lobbying to get some efforts at the ministry level as it relates to whether it be funding or recognizing the needs of individual boards. I think one of the things that we need to look at is that OPSPA does recognize that we are in a bit of a crunch situation because the administration line of our funding is being reviewed at the ministry level. That is where our funding comes from, our money comes from to pay for our OPSPA fees. And when OPSPA has indicated that they will be looking at a fee review, they're keeping that in mind so that they understand that there is a tight line for us to spend the money on. They're not going to gouge us, but they also need to make sure, and I have very vocally at the table encouraged them to make sure that they ask for what they need. I can say that over the last few years that I've been a member of the board of directors, they've been very lean and efficient with the staff that they have over the years of me being a trustee. OPSPA has reduced the number of staff that they have. They have a number of people that are on contract basis and will do contract work for them. They do top-notch work, and we're getting some of those results recognized by them for those efforts. So OPSPA has found ways to continue to do the work that we need to do with fewer and fewer resources. And I think what we've done so far has been tremendous, but in order for us to get some of the results that we're looking for as boards of education districts, we need to be realistic that we are going to get a fee-for-service type environment, or we need to increase the regular fees that we're paying on an annual basis. I think that I leave it in the hands of the trustees, but certainly I'm not supportive of Grand Erie's letter. And I've been very vocal at the board directors table to indicate that we really need to be cognizant of the cost that we incur as a board of directors, as an organization, to lobby on behalf of public education.
Great, thank you, Trustee McDonald. Trustee Karkner.
I haven't been involved with OPSPA very long, but in my short experience with them, I do feel the need that we keep our involvement with them, as should all of the boards in Ontario. As you know, I'm involved in the program committee now, and I'm attending my first meeting on the 4th of November. But as an alternate last year, I kept track of all of the work that the program committee has done, and a great deal of that certainly benefited the boards in Ontario. And I would hate to see that jeopardized if budgets are being cut. They are suggesting in the response to Grand Erie that they are bringing forward a new fee, or reviewing the fees, and following the Ministry of Education administrative funding model. Hopefully something will be worked out that would be fair and equitable to all the boards, and I would like to wait and see what that is. I too was upset by the threat that the Grand Erie board did put in their letter, that if you don't do something about it, we're pulling out. We've already had one board pull out from OPSPA, and at the meeting this summer, in July, there was a lot of concern about that board leaving, and trying to encourage them to come back into the OPSPA group. I would like us to respond as a board to Grand Erie to say that we would hope that they would see the importance of OPSPA and the work that the OPSPA does do for our boards, and that to wait out to see what the fee review will look like, and then to consider, I don't know if you can come out and say, consider the threat that they put into their letter, or reconsider that threat. But I would like to see some kind of response to show that Upper Canada is certainly very supportive of OPSPA. Thank you.
Trustee McPherson.
What we have to acknowledge here is, like as Carol says, they are bringing forth a new funding formula. each board annually makes a decision whether or not to continue their OPSPA membership. It's not like it's mandatory, and I'll be honest, I'm not the greatest supporter of OPSPA at this table, but it's the only game in town. There is no alternative, and they are an effective voice for public education in Ontario. So, they're bringing a new policy. I agree. We send Grand Erie a letter stating our rationale for continuing to back OPSPA, because it's not something you can shop around on. If we didn't have OPSPA, we wouldn't have a united voice in Toronto. Plain, pure and simple.
Thank you, Trustee McPherson. Trustee McAllister?
I echo everything that was said by the others, so I'm not going to repeat it, but would you like a motion authorizing you to write this letter?
Yep, that'd be good.
I so move that the chair of the board be authorized and directed to write a letter summing up the comments in support of the present OPSPA role in the lives of boards in Ontario.
I'll second it.
All right, thank you, Trustee McDonald. Any other comments before we move on? So what I'm hearing is that that the fee should reflect the expectation of the member boards. I think that's pretty fair, that we should wait, that at a minimum we should wait until the admin funding model review is done and OPSPA has had a chance to respond.
Yeah, just, Chair...
Yep, go ahead, Director McDonald, Trustee McDonald.
I think the intent, and I pushed people at OPSPA quite vigorously to try and get this thing wrapped up, but understanding that they want to ensure that they tie it to the administrative funding line. They're taking their time. OPSPA is taking their time to make sure that something's not put in place that doesn't make sense if the maneuvering, the readjustment of the administration line put in place either cause problems for other boards. So one of the things
we're struggling to hear you, David. Maybe you can...
Is that better? Or?
Yeah, it's better.
One of the things that OPSPA has done is they've kind of looked at it on a year-by-year basis right now. So this coming year, we've just basically instituted an inflationary rate, frozen the fees, but put an inflationary rate onto it just to cover some additional costs. But they're doing it on a year-by-year basis until that administration funding piece is satisfied. So as much as we would like OPSPA, or I would like OPSPA in particular to be quicker at it, they want to make sure that they don't do any damage or any undue hardship to boards if the administration funding side of things turns ugly, changes completely, those kinds of things. So they're trying to be cognizant of that and want to do that. So as long as we take that into consideration while we're drafting the letter, I'm supportive of that.
I find it difficult, though. I need someone with a calculator to do some quick math. Our fees are $65,000 and our budget's $345 million. Can somebody tell me what that is as a percentage? It's not a percent.
0.5.
0.0005.
All right, come on,
Rick will give us...
Mr. Gales, you're supposed to have this done for me.
I didn't hear what the amount was.
60,000 and our budget is $345 million.
Yeah. Too many zeros without a calculator.
You know, so I find it hard to believe that boards would find that, say, a 5% increase in your OPSPA fees, which would translate into an infinitesimal amount in your budget, when we've seen I find it hard that it would be a stress on boards. I can understand that boards want to be very careful how they spend the money, and I'm totally in favor of that, but it puzzles me that this somehow would be seen as a stress. But I know, David, that you are speaking what is talked about around the table. I know that. I've been there and I've heard it. But it just astonishes me that somehow that could be seen.
Well, I mean, Mr. Chair, if I may, in fact, this current year, it's not that we didn't see an increase, we didn't see a decrease, because if we would have, if the letter of the law was put into place, with fewer students, we potentially would have paid less. But what they did was they froze the rate. So regardless of what our enrollment was, we were paying based on previous year's enrollment, which, you know, in my mind, it's not truly an increase, it's a status quo, which I was quite content with. I was able to support that, and I spoke to that at the table, at our table at the time as well. And I think, I was very pleased to be able to say at the board of directors that, my feeling was Upper Canada would be able to support this. The people who are sometimes having difficulty with these are the potential growth boards, York and Peel and those kinds of boards. They don't obviously want to pay anything extra than what they pay currently, and it is a constant battle. So it is a bit of a balancing act when we look at our fees, because those growth boards don't necessarily want to pay based on their enrollment. And I think if we use the analogy of the wording we use as far as a percentage of our overall budget, it kind of lessens the board's argument as to why. Very good argument.
So it is like nothing. Like it's so small, like even the iPhone says that number's too small. It's ridiculous. It's like less than 0.02% or something. Like it's a very small amount. So anyway, the third point that I think that I heard Trustee McAllister mention, or somebody mention, was that we should say something about we're not sure that board should use their membership as a negotiating tool. And I think that Trustee Carpenter said that. I think that might be important to put in, because this is a standard reaction. Well, we'll just leave. If you don't elect us as president, well, we'll just leave. We've heard that before, and maybe that was my mistake. I should have threatened. Are there any other points that I'm missing? I think I've got the three main ones. Trustee Carter?
I noticed that they letter copied every other chair of every other board.
Yeah, I think we should do that, too. I think we should do that. Oh, yes. That sounds like fun.
I think you have to go beyond the work that OPSPA does in Toronto. You have to look at the networking opportunities that you get when you go to their AGM. You get to meet trustees from all across the province. You get to share war stories about your problems and your successes. And it is a tremendous networking session when you get that many people in one location.
Trustee McRae?
Through you, Chair, without making the letter too long, maybe we need to point out to them the value added of being a member of the Ontario Public School Board. Maybe they need a gentle reminder of all the incredible things that the Ontario Public School Board has done for public school boards in Ontario. Maybe maybe we need to highlight that to them, just remind them of that.
Well, if we were going to go that route, I'd almost like to do that in passing, but to talk more about what OPSPA could be. I mean, still, to this day, when you look at television coverage, media coverage in general, who do you see representing a non-government viewpoint? You're seeing People for Education, you're seeing OISE, you're seeing other groups, but not the representative of the organization that represents the most students in the province. I mean, we represent half of the students in the province, and yet we are never included on those things. And I think in part it's because their resources are stretched dealing with so many issues that they can't dedicate the kind of networking and lobbying initiatives that need to in order for our voice to be heard. So,
yeah, okay. Trustee or Chair, if I may.
Go ahead.
I certainly agree with you, and I think some of it is attitudinal. In the past, OPSPA has been very wanting to be quiet about the work that they're doing and the behind-the-scenes approach. And I truly think that it's time, as opposed to a reactionary board or a reactionary group, we need to be a little bit more proactive and certainly be, set the agenda as opposed to reacting to the agenda as it relates to public education in Ontario. I understand the Ministry of Education covers most of that, but what do we want people to be talking about as it relates to education, more so than how are we reacting to what's happening to education? And so I've pushed, and other board of directors have done that as well. And I think slowly but surely we're trying to make some of those things occur. So we are getting into some of those things, and it's similar to what we experience in our own areas, our own constituency areas, that sometimes the media chooses to do what they want as far as who they're going to call and what piece of the story they're going to cover. So we do have some work to do, but we have gotten a little bit better over the last few years. So certainly agree with what you're saying, but hoping that we can be encouraging of changing the agenda a little bit and move forward. I don't want to be as harsh, I guess, in the sense that we don't do anything, but we need to make sure we do more.
Thank you, Director.
Just a point of information, I know this is very political, but Trustee McDonald at the debate around the table, having worked for two other boards, and one board would look at this number and debate it all night long, because with 200,000 students, the number got much larger, and what they would look at that particular time, and they would equate, well, that's 19 EAs, or it's 3 teachers, or whatever type of things you go through. I would say, David, I'm just wondering, the grand jury letter, having read it, that perhaps the letter that you would play a role in shaping that with the chair would have to be asking boards of education to think bigger and to understand the political nature of OPSPA to ensure sound public education. And there's a cost to it. To equate those dollars to individual assignments within a school board is extremely narrow and self-serving, perhaps, for an individual board. If we all thought that way, we wouldn't have an OPSPA. Just want your comment, David. I remember sitting around as a senior officer with another board debating this till 1 in the morning about, well, that would be an addition on a school or that type of thing. So I just want to hear if you've heard similar talk around that table with the directors.
Yeah, and as I said earlier, certainly there are some boards that do have those comments, and it's not an easy vote when it comes to establishing fees over the past few years. More particularly, this most recent one was a little bit easier because we looked at freezing it. So only boards that were really in a huge decline had anything to really say about it, had some concerns about it. But boards in general, I mean, when we've made adjustments to the formula, how we charge those fees, and some boards were hit a little higher than they would have in the past, and they have some comments to make. I think it's the narrow focus that they do have, as you said, about just looking at that one isolation factor and trying to equate it to that one level, and not having the ability or willingness, I should say, not the ability, the willingness to look at the bigger picture and the grander of it's more than just their particular board. It's about the promoting and pushing the public education agenda forward, and helping their boards in an indirect way, but more particularly helping the province of Ontario ensure that we have that public education agenda the foremost. We're shaping it as a group, rather than responding to what's happening around us. So certainly it does fluctuate from year to year, and the growth boards, they are the ones sometimes that carry a big stick, because if they threaten to leave OPSPA, and they have in the past, it's a huge revenue dollar coming out of the OPSPA collection. And when boards do that, it has an impact on how successful the organization can be. So, you know, it's as I said, it's a balancing effect to try and keep those boards happy. Just as we hear across the province, right? I mean, you hear these large boards that carry the big stick and get the influence of ministry or whatever the case may be. They do the same thing at OPSPA. And fair as it is, it's the reality. And I think OPSPA staff has done a really good job to try and find the balancing effect to make sure that they pay their fair share and the remaining boards, whether they be large or small, are paying their fair share as well. So I think, you know, every chance that we can, whether it be through the professional development opportunities, trusting the person who said, through the gathering, or whether it be the board of directors table, we need to stay consistent on our message that the fees for service that we're paying right now, as far as our membership fees go, are well worth the dollar. Look at the big picture side of things. If we continue to do that, you know, hopefully we'll break down some of those barriers with other trustees and the board.
All right, thank you. We have a motion on the floor to ask me, and I will use various resources here, including the director of our director to OPSPA, to help me write this. Write a letter reflecting the nature of our conversation. We have it moved and seconded.
I'm John, Ms. Halster moved it.
Do I have a seconder?
I did.
David seconded, that's correct. David seconded. Any further comments or questions? All in favor? Opposed? That carries. Great. Thanks very much. Thank you, David, for making yourself available. We'll now return back to the regular order. So the next item up on the agenda is implementation of customer service standard within Ontario, no, that's not right. Anyway, I'll let Mr. Mills explain it to us. And Superintendent Edwards, do you want to introduce this, or are you going to let Mr. Mills carry on?
I will let Mr. Mills carry on. Tim Mills was last year coordinating principal for student engagement, and still is working with us, and is also working with the Upper Canada Leger Centre now.
Okay, good evening, everybody. I'm here with you tonight to provide a status report on the implementation of customer service standards with the AODA Act of 2005. Your background information on the report with customer service, we've met the requirements with the report that's included in your package. And I want to also highlight the leadership we have when you start looking at the next standards. You think Ron Cottenham with his team in transportation, our CIO Jeremy Hobbs with information and communications and built environment, and Superintendent Charlotte Patterson with her team in human resources. While this may seem like an add-on, it's certainly huge. And we have till 2025 to implement all of the required standards. When you think about the previous report you had on mental health and how that ties into the standards, as well as what's going to come after this with equity and inclusive education, how it all ties in nicely. When I start the slides at the end, I'll also talk about best practices that are going on within Upper Canada. And Alison Inglis and Jim Sophia talked greatly and nicely about what's going on within student engagement, but a lot of that is also going on within our schools, the great work with students and adults and even the community coming in as well. You also have some attachments in your package, and I know you had a report a little over a year ago from Associate Director Carswell. about Policy 437 and the 5 procedures that go along with it. So just some background. I know there are a lot of new faces around the table since this was brought to Committee of the Whole before. The Act is to be fully implemented by 2025 to develop, implement, and enforce accessibility standards in order to achieve full accessibility for Ontarians with disabilities in those areas that are highlighted there. About a year ago, all the principals, vice principals, senior team had a presentation by Timothy Andrade, who's a Disabilities Awareness Coordinator with the Ottawa Hospital. He then came back and also did a presentation to all our student engagement staff, and he highlighted the training module that we have. So on our board website, and I'll show you later the link, that you also have it in your package, that all staff were sent a link and were required to take part in this training. We also need to go deeper with this to include everyone around this table, third-party providers who would come into schools, those who are new to the role, occasional teachers, and the list goes on. So really, this is big, and it involves everyone. Allison and Jim talked about, all of the staff we have to work with disabilities, but we're not just talking about children. We have a duty to accommodate for staff as well as the general public. And we also know, you were talking about mental health, that it can be visible, partially visible, or hidden in nature, and it can be either permanent or for just a small period of time. The list of disabilities, which would include physical, medical, mental health, developmental, learning, injury, which can be shorter term, intellectual, and sensory environmental. And while we're I'm giving you an update on customer service standard. The other 3 that are integrated accessibility standards include information and communications, which is in motion, employment standards, transportation standards, and built environment. Just let me talk about transportation briefly. I had a conversation with Ron Cottenham and Sharon Potter, who you know has looked after our special transportation department for needs for a long time. And we have a number of fully accessible vehicles on the road. The training modules that are ongoing for bus drivers and and teachers in schools are to be admired. We have CHEO coming in to deliver wheelchair and special needs training, autism, and the list goes on there in terms of transportation. As far as barriers, and you may have some questions after, but there are 5 areas in terms of identifying, removing, and preventing barriers, which include standard architectural and physical, information and communication, attitudinal, technology, and systemic policies and practices. So the customer service standard specifically, education is a service under the Ontario Human Rights Code, and it requires a school board to accommodate anyone with a disability. And the principles listed there, respect for dignity, individualized accommodation, inclusion, and full participation. And what we were required to do and then report on, and that's with Policy 437 along with the procedures, provision of goods and services to persons with disabilities, integrating accessibility planning into regular practice, and ensuring that all of our practices and procedures are consistent with the following principles. And I will let you read those. One of the key areas there is the staff training, and the real necessity for us to go wider and deeper with that. And the principles and requirements continue there. And I had a conversation with John O'Connor this week about emergency preparedness, and that's on the radar as well, with the requirement to be in place by January 2012, which is coming upon us. So in terms of ensuring compliance, the role of the committee is to provide leadership and coordinated approach, review, develop, and implement the policies and procedures, and to train all UCDSB staff on the 5 standards. And the key there is over the next 15 years or so, and look around. We have a responsibility to do this, but how many of us will be at the table in 15 years? Just in my experience in special education, oftentimes when you talk about disability and accessibility, it's seen as a responsibility for spec ed, but really it's every person in every aspect of our society, and we need to effectively collaborate with other boards and organizations as well as government ministries, and consider how we can involve you, SEAC, principals, federations, parents, students, seniors, all of us together. But what really is, I think we should be proud of with our board is what we have in terms of best practices and how this dovetails nicely into the need to meet the standards for the Act. On the walls, the eight virtues with character always. We talked about mental health to start, and there were questions from the floor about how we're meeting the needs of students, and there's one. Our board-wide philosophy, which continues to grow on inclusion and commitment to integrating students with special needs. Allison Inglis and Jim Sophia talked about smart inclusion, the use of technology, and I'll talk about that down below, assistive tech. Safe schools implementation, you think what our late Superintendent Ted Kennedy, what he did in that time, as well as Superintendent Coombs and now Val, Superintendent Allen, have taken up the torch with that. The equity and inclusive education strategy that you're going to hear about shortly, and a few other things. Sabrina's Law. Last year I had 2 bookings for sign language interpreters in school where a parent required signing at an event, and we, through student engagement, provide the funding for that. And the last one there is the commitment to the use of assistive technology. And you think about 5 years ago, hearing about, or more, with Associate Director Carswell and Superintendent Lumsden and CIO Hobbs, the vision, starting off thinking about what we could do and where we are now with it. It's really become a model for the province as we move forward, and people are envious of what we do there. I mentioned the ongoing training of existing and new staff. There's a link on the board website, How May I Help You, which offers staff and school boards an orientation to the new accessible customer service standard. And the link is there. And just to put this on your radar for future requirements, emergency procedure plans or public safety information. And the contact there would be John O'Connor. Procuring or acquiring goods, services, or facilities under Superintendent Gales. I also spoke to Ron McLaren, who informed me that that's nice, Tim, but I'll be retired by then. I said, until you do retire, though, McLaren, we have to look at this. And also employment standards, which is 2014, which would include policies and procedures for recruitment. And the link you see at the bottom there would give you all of the regs and the requirements with different dates related to the different standards. I wouldn't recommend it you read it tonight.
right, thank you. Mr. Mills, any comments or questions? Trustee McAllister?
Tammy, you've given us a lot to think about there. The question, one of the issues that it seems to me that is key in this whole thing is the issue of training for staff. And you made mention of the training module that's offered to staff. Is this the only opportunity for ongoing training?
At this point, yes. But we recognize that everyone within the organization, including OT staff, casual staff, people who will volunteer, require this, and that's in motion now to make sure we meet those needs.
Thank you.
Just on a number, it's almost 3,000 staff that have engaged in the online training modules. Big job.
What are the ministry requirements in this to support us?
I'm not sure I know. I'm
sure you know. Well, they set up these rules, right? They set up these expectations, and I just wonder if they've made a commitment to us to help support us either financially or in any other way to meet these requirements. Mm-hmm.
I don't know if I could deflect this a little bit. For example, in construction, I don't know if you can help me, Mr. Hobbs, but within the general budget, we would get a certain amount of funding from the ministry, and we might have requirements to remove barriers or make. Is that what you're asking, or?
Well, I mean, they're very good at creating the expectations for everybody but themselves, and I just wondered if they had bothered to create any expectations, like, this is what your mission is, and this is our commitment to you to support you on this mission. Go ahead.
Mr. Chair, because the accessibility standards for the built environment have not been formalized as a regulation yet, I think what you see in the standards that have been formalized is that there's very little specific direction with respect to the built environment, which in other words means facilities. And without surmising why it's taking a long time to formalize the built environment standards, I would suspect it's because with respect to new construction, the financial impact would be fairly low, probably an addition of around 4% to the cost of construction to implement all the additional measures with new construction. But when you're doing major retrofits, there's been some estimates to say it would effectively double the cost to implement all the measures in an existing school, like one of our older schools, for example. So that may be what's slowing it down. And because I think the built environment standard has not been formalized, we haven't had any money allocated towards that specifically by the Ministry of Education. That being said, our tactic with respect to accessibility has been, at least on my tenure, is when we are doing new construction, we build fully accessible. So if you go to Van Cleek Hill Collegiate, for example, or to the new North Granville District High School, we're pretty confident those will meet the accessibility standards for built environment when they're eventually released. And then at our remaining schools, we address those on an as-needed basis. So if we have students who are interested in coming to our schools and have needs for specific accommodations, then we make the money available out of our regular renewal budget to make modifications. Although it won't be perhaps as extensive as making the whole school accessible, we really do try to make those schools welcoming and accommodating places for the students who have those needs.
And there's been a reflection in your budget to accommodate those initiatives?
There hasn't been a specific allocation from the Ministry of Education.
And in terms of support for training? Has there been anything specific from the Ministry to support that?
Not that I'm aware of, but I'll just give you an example with transportation that we will use, for example, Cornwall Handy Transit or Brockville Handy Transit through funding, the student engagement budget. We for the longest time had either vans or small buses that were fully accessible. Now the companies are now making buses that are fully accessible, so we have 2 on the road now that we will grow over time. that hopefully we won't have get to the point that we'll have very few small vehicles on the road, that we'll have many of our students, a high percentage of our students, we do now, but I mean even more, riding on regular school buses that are accessible.
Sure.
Trustee McDonald?
Thank you. I was trying to get in earlier, but I forgot to take mute off, so I apologize for that. I just wanted to comment. I have a bit of experience around the built environment issue, and also just from an OPSPA perspective as it relates to Ontario and the Disabilities Act. For the built environment, there is no expectation that there will be any funding associated with this in anybody's requirement. The current building code has, as Superintendent Hobbs has indicated, there are certainly provisions within the current building code for new buildings and any major material changes within the construction would require you to meet those minimum specifications for accessibility. I guess the trick is that, and I know this is more about customer service, but just to stay on the built environment for a second, is if one individual did not touch any building between now and 2025, by 2025, regardless of whether we made any renovations to that building, those buildings need to be handicap accessible. And accessible in whatever terms may be. We don't know what eventually will happen between now and 2025. Getting back more to the customer service side of things, OPSPA has had a member sitting within the committee associated with the Ontario Disabilities Act, and it's been very frustrating because this is not something that's being pursued through the Ministry of Education. This is something that's being pursued across the province of Ontario. It's impacting municipalities, colleges, boards of education, public institutions, and to some degree down the road it will impact private businesses because there will be a requirement for them to be accessible as well. That's where the agenda was being taken to, so that across the province of Ontario people would have accessibility to any building. From a customer service standpoint, some of these standards are going into the realm of, and I think we've covered it fairly good, but if you have one person who is deaf, having the requirements to provide sign language to that person, whatever the case might be, even if it's on a one-off basis. So it has been very harsh, I guess, is the word, my word of the day. I guess I've used that a couple times now, in the sense that there's many implications associated with customer service, being able to provide services to individuals with needs. And it's not just simply around physically impaired, it's around any impairments you may think of. And there is no assistance being offered. There is training being offered by other agencies, but not particularly through the province of Ontario. And, these are one of the things that OPSPA works at, to try and make the Ministry of Education aware and allow the Ministry of Education to go in and fight with Treasury and other ministries to say, this is one more implication that you are making across the province of Ontario, just as you did with drinking water or safe water, just as you've done with many other things, that is costing, requiring boards of education to spend more money, yet with no funding. So it is on the radar with OPSPA. It is something that causes grief across the province for other boards of education. And I think we've handled it fairly well to make sure that we are accommodating and living up to the expectations of what the regulations are so far.
Thank you, Trustee McDonald. Trustee McPherson?
Just to follow up on Jeremy's comments, do we anticipate another revenue stream when the requirements to modify existing buildings comes in, or are we probably looking at simply being told to take those funds from somewhere else?
Mr. Chair, I'm not really anticipating. I think the word I'm using is hoping. My crystal ball is cloudy on that front. I think the way we are starting to prepare is, as I said earlier, our approach in the past has been a little bit of a bottom-up approach. So when the need presents itself, or we have a student with a particular need, we address those needs in the school they wish to attend. What we're starting to do now within the facilities department is trying to take a bit of a top-down approach where we start looking at what the vision is for accessibility across our board, and trying to start metering out some of our renewal funds every year to address accessibility projects. And we'll obviously put them in places where we feel that a need might emerge, but we're just starting to actually take a more proactive approach to that and doing some every year where the needs emerge. But I wouldn't venture a guess as to say whether an additional revenue stream will be coming.
Okay, thank you.
Any other comments or questions? So in light of the expectations here, we'll give you a scenario and tell me whether there would be an expectation for us to provide a service. Say there was a deaf parent that attended a school council meeting. Is there an expectation for us to provide signing for that parent?
Yes.
You know, like, that's what I'm driving at by the no money flowing, because not that, I'm sure it can be handled, but like, it could get very expensive.
And as we move forward, for example, making this meeting accessible, I'm not saying, you know, how does someone identify when they come in the door here that they...
Or even by mere fact that we do the webcast and don't offer an alternative non-audio stream.
So there's been a lot of good work, awesome work gone into this, but always room for improvement to customer service.
All right, so no further questions. Thank you very much.
Thank you very much.
For your presentation. Something I'm sure that we'll hear more about as we move forward through this board, and it sounds like the next, and the next, and the next, and the next, and the next one. Providing they're still boards. Maybe if the ministry spent less time calculating caffeine and drinks.
There's a lot coming up, right?
He hasn't had his coffee yet.
Okay, we'll now move to policy, discussion on policy 453, assessment and evaluation. Invite Associate Director Carswell to introduce this item.
Thank you, Chair Petersma. It's my pleasure to introduce two of our curriculum dynamos who have we've been great beneficiaries of their outstanding leadership in supporting our elementary and secondary curriculum and program efforts. So Scott Corden and Kathy Sawyer-Griffin, if you would come to the microphone and inform us on assessment policy.
Thank you, Associate Director Carswell. Chair Petersma, we would like to, if we could, distribute some materials that are relevant to the background on this policy. Some of our practices, maybe even draft procedures that are relevant to the policy. It helps provide, I think, some background information.
Okay. 8:46. Yeah, go ahead and do that. I can save it to do that now.
Chair Petersma, the documents or the kits that you people are receiving is part of our board's response to the new policy by the Ministry of Education in Ontario 2010 on assessment, evaluation, and reporting on student achievement. As Kathy and I were reflecting on this in our over 50 years in classrooms and in schools, assessment and evaluation has really evolved. It has really changed. And assessment and evaluation are terms that Kathy and I and probably others used to use synonymously. And those have really changed, I would say, especially over the last 5 or 6 years, not only in our jurisdiction in Ontario, but in Canada and other educational jurisdictions. Assessment, I think of as more sort of the coaching of students and working alongside students, perhaps offering suggestions as to their next steps, but also a reflection and looking at our own practice through the work that we see on the student's desk and through the conversation that we're hearing. So you'll hear the term assessment for learning. So assessment for learning is both that, what is the student work and student conversation telling us about next steps for them, and what is that telling us about next steps for us in terms of instruction. Assessment now, you will also hear assessment as learning. And assessment as learning, you'll often see the term metacognition with that. So students thinking about their own thinking. So not just go and do this, but it's really very interesting as we get into more and more classrooms across Upper Canada. It's not unusual for us to hear a grade 2 student say something like, I need to draw a picture. I know I learn better when I can see it. Or a grade 3 or 4 student say, well, I know how I tackled that problem, but Jeremy, tell me what you did over there. I don't understand that. Tell me how you sort of came about that. So I think that's the essence of metacognition, where the students are really aware of their own thinking and how they go about tackling problems. And the other part of assessment that we see is assessment of learning. And I think that's more akin to our, at the end of the day, the evaluation of. So that document, again, is our board, part of our board's response to the Ministry of Education new policy in 2010. All boards in the province were required to respond to that, either create policy or revise their policy in light of some new direction. I think one of the first things that we noticed, and other people across the province noticed when this came out, was the prominence on learning skills and work habits. The province chose to list that as their first chapter in the new policy. And again, in the past, we've tended to put that aside. We've tended to almost list that as a second thought after academic achievement. And if I can refer to the provincial document, Conference Board of Canada, Human Resources Skills Development Canada, and other national and international organizations are recognizing that those learning skills and work habits are critically important to student success, not as an afterthought, but things that are equally important to content knowledge. So I think, again, in the ministry putting this up front in their documentation is a signal that this is no longer an afterthought, that this deserves equal consideration to content knowledge. Another thing that's clearly laid out in the provincial policy is that assessment of and reporting on learning skills and work habits is definitely separated from achievement of curriculum expectations. So again, some of the experts, not only in our province, and Chair Petersma, you mentioned OISE as a body before. We hear from folks like Garfield, Ginny Newman, and OISE, Dr. Reeves in the States, Ken O'Connor, other prominent educators and leaders in education, talking about the clarity needed when we're reporting on achievement of learning expectations and keeping that separate from reporting on learning skills and work habits. We have in the past had a tendency to mix those up, and as those folks point out, that no longer gives us a clear picture of how students are achieving those expectations in the curriculum. Those things need to be kept separate, and our draft policy reflects that. Chair Petersma, I think everybody has sort of a copy of the draft ahead of them.
Yes, we do.
If I may, the Upper Canada District School Board supports the notion that the primary purpose of assessment and evaluation is to improve student learning in accordance with the Ministry of Education Policy Growing Success 2010. It is the Upper Canada District School Board policy that assessing, evaluating, and reporting on the achievement of curriculum expectations and on the demonstration of learning skills and work habits are done separately. Evaluation of learning skills and work habits shall not be considered in the determination of a letter grade or percentage mark evaluating achievement of curriculum expectations unless those skills and habits are specifically referenced in the expectation. Late and missed assignments will be addressed as part of the student's development of learning skills and work habits. Mark deductions will not be applied to the evaluation of curriculum expectations without consultation with the school principal. And the director will establish a protocol for reporting student achievement below 50%.
Okay. Trustees, any comments or questions? Trustee McAllister?
Chair, I have some questions and comments about this particular policy. And I will apologize in advance to Scott and Ian if I appear to be perhaps unduly harsh, but I have some concerns. This growing success document represents a significant departure and in pedagogy as well as policy. I think you've pointed that out very clearly. The student evaluation is a product of observations, conversations, and student products. Then from there, a teacher takes all this into his professional or her professional judgment and interprets a mark or a grade, right? What concerns me is that I see no mention here, and as the guideline dictates almost, that we have worked collaboratively with school committees and parents, for example, to determine the lower limit of the range of percentage marks below 50% that teachers may record on their report card, especially in the 9 to 12 range, grades 9 to 12. And frankly, I don't think it's sufficient to say in this policy that we leave it to the director. It's rather unclear. The evaluation policy deals very clearly with the consequences of cheating, plagiarism, uncompleted work, or work that is submitted late. I don't see how that is reflected in the policy. I know we address it. It says they will be addressed, but how, I guess, is the question I have. I think there's a need for clear guidelines for parents and students and teachers, and a need for public consultation, as I said, with school committees and parents. And the purpose of assessment evaluation is to improve student learning, and that is our goal. In this particular board, that goal is 90%. In the province, it's 85%. Having said so, I think we as a board have a duty to guarantee the integrity of the credit and the integrity of the diploma. And I suggest that this policy needs more clarity, greater elaboration, and more detail. I'm sorry to rain on your parade. I hope I haven't done that. It's not my intent, but that's what I feel as a trustee.
Thank you, Trustee McAllister. Trustee McMillan?
There's someone else that want to go?
Somebody want to respond? Okay, go ahead.
Okay. Thank you, Trustee McAllister. If I can, and maybe this is my misinterpretation of policy versus procedure, but I think what we've attempted to do in some of the work in front of you is to look at practice and perhaps draft procedure. So if I can get you to refer to the blue folder.
Which one's blue?
There are a couple of inserts, one on late and missed assignments, one on cheating and plagiarism. And again, I see those more as procedural than as policy. So I'm wondering if that, John, if that addresses sort of a policy, if you can refer to that.
Okay.
a procedure.
Supplementary, if I could.
Sure, go ahead.
My concern with the distinction between policy and procedure is that if we have a policy and a procedure, which we need, of course, to implement the policy, that it should be very clear and understandable to all parties. I'm wondering, do you feel it is? Has there been consultation with parents on the development of this policy?
I want to make reference to the speakers that preceded us this evening. I think in interpreting, as I was sitting at the back and listening to Drs. Inglis and Sophia, I was hearing, I guess, not that a one-size-fits-all, that we need to be respectful of all of the learners that we had, and I guess I'm cautious of a policy that sets out what must happen or what can't happen for everybody, in that in working towards a 90% graduation rate and trying to address all of our learners, there needs to be latitude at the school, consideration for things like the student success team meetings that those people spoke about. In the procedure, if you will, the last bullet talks about consultation with principal. If after all of these other things have been considered, then we're still thinking about an academic penalty, which again, we feel blurs the lines, then that's still there if and when you get to that point. So again, that's something that we had considered and is there, but again, I guess I view that more as procedure and possibilities rather than a policy where every student in every situation in the board must follow.
Trustee McAllister,
I'll stay here. Thank you for now.
Trustee McMillan?
Through you, Chair, I was interested to see where you were going with that. This has always been an area of deep concern for me with assessment of learning and assessment for learning. Being an elementary teacher my entire career, there's been a lot of focus on providing teachers at that level with a deep knowledge as to what the differences are between the two, and it is not only expected, it's demanded that you will address that in the way you evaluate and assess students. My issue is, it seems to stop beyond grade 8. And as you move into high school, there is the assumption, not by all, but by some, that the rules do not apply to them because they can still do it the way they've done it for the last 20 years. And I would like to see this policy addressed for all, and I would like to see the in-service go to the people who need it the most. And elementary people will continue to need in-service in this, but I do believe that there is a huge void in our secondary panel into the way the new assessment needs to be done. Because they want to cling, for their own personal professional reasons, they want to cling to the mark, and they want to cling to that final summative assessment as the be-all and the end-all. And the problem with that is, yes, that does, John, ensure integrity with the program, but it does not help a student develop. It only gives us a final grade, a mark on one day at one particular time, and it misses the boat on all of the other things that this policy is talking about. And there's some powerful stuff in this policy. There's powerful stuff in assessment for evaluation, and being able to have kids learn and learn through metacognition and learn through the steps before they are given a final stamp of approval by a mark is very valuable. And it's just through 30 years of observation, through listening, through watching, there seems to be a wall at the end of the elementary panel where people believe the rules don't apply anymore. And I'm not saying that happens in all cases, because I know there are lots of our secondary teachers that are on board and fully understand. But I know when you look at that section in there about not allowing them to take marks off the late assignment, I would love to be in a staff meeting and listen to that discussion, because I think we all know what it's going to be. So I would like to see the in-service for this taken into the secondary panel and focused heavily on that area, because I think there's a huge need.
Thank you, Trustee McMillan. Trustee McCray?
Well, I haven't had the opportunity of being a teacher, and just received this document this evening, and seriously, before I would make any commitment to it, I would really need to read this and spend a lot more time giving it consideration. With what I received on the agenda for this evening, to be perfectly honest, I wasn't exactly sure where this was going, and I think this needs a lot of further consideration before we go further with this.
Trustee Swan?
I concur with Trustee McCray. I would like to see this brought back as well. As a parent and not being an educator, the late and missed assignments being addressed, my first thought was, what are we teaching children about responsibility? One child does everything, the other child just chooses not to hand it in. I mean, marks can be deducted, can't. How are we equitably doing this across the board, across the schools? I'd like to see a lot more, I know, policy and a procedure, but I'd still like to see a lot more details to this policy, especially this point. And I too have not had an opportunity to read these documents, and I would like to address them further.
Okay, first of all, trustees, I have a comment to make to you. Nobody around this table needs to apologize for what they aren't, all right? We have teachers, we have farmers, we have business people, we have homemakers. Everybody brings a different voice to the table, and I know that this may be a topic that teachers can speak more freely to, but you bring just as valuable insight, Trustee Swan, Trustee McCray, as our members who have been teachers, and I'm not comfortable with the fact that you feel it necessary to apologize. So I just ask that we try not to do that and be determined to represent the views that you bring to the table. I think Trustee McPherson.
I'll bring the fire matter.
Oh, wait a minute, sorry. There was a comment to respond to Trustee Swan. Sorry, Mr. Gordon.
Thank you, Chair. Well, folks, I think what we're trying to get at is really a cultural piece here. We're absolutely not trying to present an out for our students. If I can quote from a couple of other folks, just some concerns over the notion of punitive measures. One author writes, first, the penalty often distorts the achievement and contributes to a mark that does not have clear meaning. Secondly, punitive nature of penalty provides powerful disincentive for many students to do the work. I know I've heard Garfield Ginny Newman at OISE talk about the most logical consequence for not doing the work is doing the work. This author also writes, that the work is done and that learning occurs should be more important than when the learning is done and when the work occurs. So the culture we're trying to get at is we want the students to do the work. We're not looking for an excuse to get them out of that, but to change the culture of, if you don't do it, you get 0, fine, I'll take the 0, good, I don't need to mark it. That's not what we're after, and we've somehow arrived at that with some of our students in some of our classrooms, that we get this stalemate where people aren't going to do the work, and that's not what we're after. And sometimes I think the punitive measures really sort of support that, sort of a banging of heads. I know we've had Dr. Bill Daggett speak to us, was at our high school summit a couple of years ago, and some of his research was done with what they called turnaround schools in the U.S. And it's interesting to hear from those students when they say, in my school now, it's far easier for me to pass and do the work the first time than it is to fail. Because when I fail, my teachers don't let me off the hook. I have to do the work. I'm in at lunchtime. They call my parents. So it's not don't do the work and you still coast through. It's you have to do the work. And I think the culture we're after is that our students know they have to do that, and they logically arrive at, it's easier for me to do this the first time and do it well than to not do it and still have to do it, and now it's on my time. So no free pass, that's not what this is about at all.
And just before I introduce Trustee McPherson, I think it's important that we recognize that policy deals with what and the procedure deals with how. So when you're looking at what should be in this document, that should be how you look at it. And if you start saying how you're going to do it, then you're starting to move into policy, into procedure, and that really is, you know, not the scope of good governance. So I just give you that, and just think about that as you think about your ideas around potential changes. Trustee McPherson.
I realize that this is in response to a ministry-based initiative. My interpretation of persons of going to school or a Board of Education is to prepare our students for the world of tomorrow. In reality, the world of tomorrow is far less forgiving than we're prepared to be in our school system. If you show up late for work, they'll take your excuse the first few times, but then you're going to find yourself out of a job. You pay your bills on time. You pay your taxes on time. So I have a hard time accepting the fact that we're preparing to embark upon an education system where if you don't submit your work to the teacher on time, that, oh, you can do it next week, or you can do it 3 weeks after that. And I'll admit, I came from a one-room school system, a much harsher system than what we have today. But I was given a work ethic that when I was told something had to be done on time, it was done on time. And as a parent, those are the values I want instilled in my children. I don't want my children growing up thinking that, I'm sorry, I don't have to have it done on time. I'll get another chance. Well, in the real world, you don't always get second chances. And yes, I will acknowledge the fact that we, as a board, probably would not have brought something forward like this on our own. We are doing this in response to somebody sitting on top of the CN Tower in Toronto saying things are bright and rosy, even though we can't see further past in Mississauga. So that's my perspective. I'll support this because we have to have it, but I don't agree with it.
I'd be interested, Director, to hear whether whether as our instructional leader, whether you see this as just implementing a Toronto policy, or whether this is also is in keeping with your leadership as in.
First of all, thank you for putting me on the spot. That's important. First of all, and I make no apology for a teacher, and I'm proud to be a teacher, but I'm going to move. I think a teacher has a right to fail a child, but a teacher doesn't have a right to fail the child. And I think what Trustee McMillan is saying is that the child, if they earn a 0 at the end, it's not going to be because I haven't done everything in my power, everything, as Scott has said. I phoned the parent, I engaged the parent, the school success team was brought in, we took a look at the IEP. Does the child have a learning disability? After all of these things are covered, and I can't help but think after all those things are covered, you get down to the bottom, and then consulting with the principal and the school policy, because remember, this is our policy of the board. The schools are going to have to interpret this and create a board policy in their school that makes sense for their community, going back to what Trustee McCallum was saying, that is included with the school council, and I would say the student council. If I took you down to Rideau District High School right now, they have one of the most profound and gifted ways of looking at where the teachers are held accountable by the students hold themselves accountable, teachers hold themselves accountable. For example, that school is interesting. I'm not sure if the associate director started this when he was there, but if an assignment was held by a teacher back for 2 or 3 days and didn't come back, the kid could put his hand up and say, what's going on here? And then they could look around here, and the teacher has to explain to the kids why the marks weren't done or where they are, and they have a right to take that to the next level. See, I think what this does is very balanced in the sense that it's going to give them the opportunity to still, potentially, I don't know how you get a 0 after spending 200 days in the classroom, but you could get a 0, and it could come to that level. But show us every single intervention that's been taken, and then at that particular time, if the parent knows, the child knows, the IEP is covered, every single thing is done, and we still have it, then you have it. I can't help but think you would never have a 0 in that particular case, but you'd have some sort of explanation for the lack of learning that's gone on in that, with that child and where they're at. What it also says is if you have a child at home with the mental health issues, then we know now that as we become more involved in the issues of mental health, we have someone struggling with an anxiety disorder or a attendance disorder, or they have whatever happened in their life, then we have a responsibility to take a look at that, see the mitigating circumstances to ensure that a child gets across the line. And I would agree with Trustee McAllister that if somehow this is perceived that we have watered down our curriculum or our pedagogical practice, I don't even involve that school board ever. But the fact is, if we have staff, as Trustee McMillan's argued, that have done this level of interventions, I want to be involved with that board for the rest of my life, because they're going to say the child has failed, but I have not failed as you go through. So it's something to think about, and I appreciate being put on the spot, because as you said earlier, I'd make no apologies for being a teacher, and if we take a look, it was important. I think what's interesting, though, Ian has lived and breathed this for the last, I think, 5 or 6 years. I think, if I may, could I turn this over to the chair to Associate Director Carson?
Through, if I may, I think one of the big ideas here, and I think we get caught up in some of our traditional baggage about how we were graded, how we experience that. I find this topic gets more emotional energy than almost any other in education. Nothing gets the blood boiling like talking about values as it relates to assessment. All of us want our children to grow up to be able to self-regulate, to be responsible, to be effective citizens. I see that as our duty to inculcate that in the pupils entrusted to our care. There's a debate sometimes about what's the best way to do that. Really what this policy is contemplating, though, is I think in our past practice we've made the mistake sometimes of mixing those very important work habits and work skills with achievement, and it muddied the water. So I get a grade. What does that mean? Does that mean that the child is really capable in mathematics, or that they were really responsible and worked hard and submitted all their assignments in a timely way? What happens when the student does all of those work habit things, but the achievement is still lacking? Or vice versa, the student who is capable of walking in and flying by the seat of their pants, but isn't responsible, doesn't collaborate, doesn't take initiative. How do I tell that story to the student, to the parents, and to my colleagues in a way that transfers meaning that can support learning? What this policy says is, separate the two. Separate the two. Don't punish achievement with the mark book. If that assignment is continually late, that is an issue that needs to be addressed. But I don't take marks off the achievement. That just clouds the issue. Let's talk about the responsibility issues. If a child is plagiarizing and creating intellectual theft, that's a very serious issue. It needs to be dealt with, perhaps through the school's progressive discipline. Now, I can't make a policy that considers whether that child is in grade 1 and didn't know any better, whether that's a child in the last year of high school who certainly did and should know better. I think the responses, to be just, would have to be adapted to the individual. I don't think I could make a hard law. I don't think I'd be fair to our children if I did. So the idea that this policy, because it considers some different ways of looking at zeros and missed and late assignments, it's not that we're suddenly okay with irresponsible students and poor work habits. Not at all. We want greater clarity so we can address the problem head on. I think really that's the key, Scott, is that the big idea here is that rather than rolling all that up and punishing students through the grade book, that we look at other ways of supporting student achievement and student learning.
Trustee Garrow, did you have your hand up? Okay. Anybody else hasn't spoken yet? Trustee McAllister.
I just want to point out that I am in total favor with the growing success document. I'm not opposed to it at all. I think it has some very good measures. What I was trying to convey was the need for consistency in all schools, the need for communication with all parents and school committees and student councils. I don't believe assessment and evaluation are meant to be tools which are punitive. That is not the purpose. They are formative. And I do think that we see a lot of good assessment and evaluation going on in both panels.
Okay, trustees, we have a number of options that we can do here, and I've heard a couple of you make reference to the fact that you might appreciate some time to reflect on the documents that you received tonight and see whether our policy is driving the impact that we want.
Could we get a look at the accompanying procedure? That would perhaps clarify what happens if policy is contravened. Even though it's an administrative thing, it adds to our knowledge.
Okay, so just a quick show of hands. How many trustees would appreciate some more time to look at this? Quick show of hands. All right. So we'll then. Go ahead.
A question for the would you want a re-look at that policy after we got we're sort of backwards, we got a procedure that looks pretty tight, but I hear you saying that maybe the policy should be more reflective of...
No, I don't think that anybody's saying that. I think the trustees are not prepared tonight to make a judgment on the policy, and they'd like some time to review that and, to get a sense of how the policy is driving the procedure or the guidelines. Trustee Swan?
And that we also get a copy of the procedure.
That'll come. I mean, that's fine. Trustee McCray?
And through you, Chair, I just would like to say that the presentation that Ian Carswell just gave, I think has given a lot of us here probably a different perspective regarding, what this is all about. And I think with that, together with the opportunity to read this material, I think we'll probably a lot of us will come back with a different perspective. But
I think I would want to make sure, my interpretation of the discussion is not that there's a problem with the policy, that there just needs to be some more time, and so...
I think for whether you want to just go back and take a look at the policy.
No, I don't think we're saying that at all at this point. I think it's just some more time, so we will just add this to the Committee of the Whole agenda for October, and bring it back, and Mr. Corden, if you could make yourself available that night, that'd be great, and obviously Mr. Carr as well. And the director should be here, and we'll have a chance to discuss it again. Is that good? Everybody pleased with that? All right, thank you, Mr. Corden, for introducing that topic to us. All right, we'll now move on to the next policy, which is equity and inclusive education. And Superintendent Edwards, you'll be leading this conversation.
Thank you very much, Chair Petersman. This policy, this draft policy on equity and inclusive education in front of you actually ties very nicely into the previous reports that we've heard tonight.
Is it possible for you, are you going to be speaking long because they can't hear you?
No, I can speak closer too.
Oh, I guess you can't see. All right, okay.
Want me to go up to
yeah,
the statement?
Please. Yeah, thanks. Camera wants to see your best side.
Okay, again, thank you very much, Chair Petersma. And this report, or this draft policy, ties very nicely into some of the other reports that we've heard tonight. just to give you a bit of background on the equity and inclusive policy, on April 6th of 2009, the Minister of Education released the document Realizing the Promise of Diversity, Ontario's Equity and Inclusive Education Strategy. The intent of the strategy is to involve ourselves and our broader community in enhancing inclusive schools and classrooms. And through this policy, it's done through identifying and addressing and eliminating the biases, barriers, and power dynamics which limit students' learning. Some of these barriers may be related to gender, race, ethnic origin, religion, socioeconomic background, physical or mental ability, sexual orientation, and many other factors. A requirement of Ontario's Equity and Inclusive Education Strategy was that all boards have a policy in place for the 2010-2011 school year. In front of you, you have the policy, and I'm not going to read through it all, but this policy upholds the principles, of respect for human rights and fundamental freedoms enshrined in the Canadian Rights and Freedoms Charter, the Constitution Act of 1982, and was confirmed in the Ontario Human Rights Code. The key points of this strategy is that equity and inclusive education has as much to do with achievement as any other factor. All students need to feel connected, and all students need to feel they belong to their community. With this, the equity inclusive policy would act as a filter to take a look through 8 areas of focus in the strategy, and these areas of focus serve to guide the actions of Upper Canada District School Board and its schools in honoring its commitments to equity and inclusive education policy. The 8 areas of focus, which correspond to policy statements, Upper Canada District School Board policy statements, are within our programs and practices policies, our shared and commitment to leadership, our school community relationships, our inclusive curriculum and assessment practices, religious accommodation, school climate and the prevention of discrimination and harassment, professional learning and accountability and transparency. The ministry has committed to ongoing funding for this. It's funded within the 6 regional networks, and there's networks of school boards working together to implement and to build the capacity for this policy and this strategy.
Okay, thank you, Superintendent Edwards. Comments, questions, trustees? Trustee McMillan.
Forgive me for how I'm going to be on this. This is a deep concern for me. I grew up in small town Brockville, and for most of my life this was never a concern to me because I never thought about it. But recently, with Trustee Swan and myself, I started to dig deeper into cultural diversity and the issues that were involved in this. And when you look at the ministry document, we were to have this in place a year ago, and we didn't. And I see this in light of all of the discussion tonight, and every night I sit and I look at our character always, and I see posters on the wall. And I think that this policy should really reflect the deep values that we share, because we know that those posters are not just posters. They represent what we are. They represent what we stand for and what we believe in. And I believe, just to back up, when I started to do my research, I started to look at different boards and what different boards did when it came to their policies on this. And I was so disappointed to see all of them with the same wording, because it was nothing more than cut and paste, paint by number policies. It didn't reflect anything more than compliance to what the ministry asked. And I asked myself, how serious are we on this issue, or are we only doing what we are told to do? Saying that, these are the questions that I have that I'd like to just throw out, and there are a few of them. I'd like to know what our current status is in terms of this. would be spoken to define our present state of cultural diversity within our own board? Do we know what our situation looks like at this moment in time? Are we aware of what cultures exist in our board? Do we understand how our cultures affect other cultures? Are we aware of the impact that our cultures and our beliefs have on others? Do we know the level of training we need to provide our staff to help them move forward? Because if we don't know what the present situation is, how are we ever going to know what it's supposed to look like after we implement this policy? So I have deep concerns that we take this as serious as we take our character always, because to me they go hand in hand. And just for example, we have to start, and we are, but we have to continue to show respect to all of our people, our students, our parents, our staff, each other. We have to look at people and not judge, because they don't live the same way we do, or they don't believe the same things we do. We can't continue to have people say, I'm not going to send my kids to that school because I don't want them hanging around with those kinds of kids. We can't do that. And in all fairness, and please forgive me for this, we can't continue to say, those people in Toronto, those people at the CN Tower. We can't continue to do that because we're doing nothing more than labeling them. And I understand why, please forgive me, I understand why. But if we truly believe that this policy is important, and I believe we should, then we have to really question the way we ourselves do business, because for the sake of our kids, we have to do better. So I ask those questions because I really want this policy to mean something, and I want it to be a lot more than simply complying with the ministry.
I'm wondering whether we're talking about two separate policies here. We're
talking about equity. We're talking about treating people that are not, we had the definition of what culture was. And culture, all of those things, gender, financial, race, physical abilities, it's everybody. And it's not taking a group of people and labeling them. And then by labeling them, we form an attitude towards those people. In the same way as we say, as I said as an example, I'm not going to send my kids to that school because of those kinds of kids. That is equity, and with all due respect, I don't see any difference. I don't see it as a separate policy. I see it all under the same umbrella.
Okay. Director, do you have a response to that?
I'm on the same page that Trustee McMillan's on. I've been on it a long time. I think we have to move beyond tolerance to respectful inclusion and an acceptance in a non-judgmental way of what people bring as attitudes and skills to our schools and community. That's very forward-thinking, and I think Trustee McMillan is defining the future that he wants, and I agree with that. From my perspective, however, we know that comes with a price. When you choose to act boldly and say that we are all more than equal, but that as a Board of Education, we will take the most unequal and make sure they get what they have to have. It goes back to something that Trustee McPherson said to a group up at Maple Grove the other night, that when we had someone stand up and say we are in the poorest area of the board, should we perhaps get some more? And Trustee McPherson said potentially should, but when you pull the balloon this way, it means something comes from another area. And what I hear you saying, Trustee, is that we have to examine those issues, because if we're going to talk boldly, we have to act boldly. And I agree with you. I think that's something that's going to take some time, because not everyone's ready for what I thought was courageous. I wish I had not been in South Carolina. I had a bit of a deal with Trustee Swan, and I know that there's been some backlash for your choosing to say not only do they have a right to be here, but I'll march for them next year too. And what are we doing in our schools to ensure these kids and these communities are treated in a safe and orderly manner, and not only that they're tolerated, but they're accepted. And I think that's an interesting thing for us to deal with.
I'm just Trustee McMillan, I'm just trying to understand, though, the issue that you have with this policy. Because
I want the policy to have depth to it, and I want it to have true meaning beyond words. And and just to go to the statement, I mean, I did not personally receive any flack for doing that walk. I would do it again because I believe you do what is right, and I think that's the bottom line of what I'm talking about. I'm not talking about cost. I'm talking about all of us doing what we know is right, and that is what that is all about. Character always, and this to me has got to have the same meaning because it's part and parcel of the same thing.
But the second line does reference character always.
It does reference it. Exactly.
So what I'm saying is, I guess...
my point is I want this taken seriously.
Okay, so it's not that you have a problem with the policy, it's that you want the policy to be taken seriously.
And I want it to have depth to it, yes.
Okay, when you say you want to add depth to it, then I think that you want to change the policy. That's the way I'm interpreting it. No?
I see it no different than all the other cut and paste policies that I saw, and we have something here that shows we're different than other boards.
If I may, through you, Chair, to Trustee McMillan, I think what I hear you saying is that you'd like to think that the procedure to support this would have the same depth that we would have for an assessment policy.
Exactly what I'm saying. I know I got going into procedure, but that's why I asked, do we even know what the state is at this point in time? We've made a policy. Do we even know what we have out there? Do we have any understanding? Because if we're going to take a document that's going to have procedure attached to it and it's going to move us forward, how do we even know where we are right now, and how do we know what that will look like when we do move forward if we have no understanding of what our cultural diversity state is in right at this present moment? That's all I'm saying.
Okay. Just wanted to make sure I understood. Any other comments or questions? Okay, so what are you looking for here, Trustee McMillan? That's what I'm trying to understand. Is what direction would you like to see the board take from this point?
I would like us to take a good look at what our present situation looks like
before we approve the policy, or can that happen concurrently?
I would say concurrently, but I think we cannot underestimate the power of knowing where we are right now.
Okay. So, I think that if no one objects then, and I didn't see any other speakers at this point, then so we can move the policy forward, but you would like to receive a report on the implementation and to include an assessment of where we are. That's what you're saying?
Also, an environmental scan of our region, of what the issues are in our region.
Now, the people that are going to have to do this, do you understand what we're asking?
I think I got it clearly.
If I just may too, in terms of the 8 areas of focus, if you take a look at the areas of focus here, in terms of what it is, all those 8 areas of focus is really saying that we have to go in and examine our own beliefs as well, and I think that that's part of this focus in terms of the strategy, is going deeper into the learning and going deeper into the understanding and examining our own practices, and as you said, for the environmental scan, or looking what's there.
I think the cost of not doing this, and we already know some of the costs are dear. None of us can afford those costs. We can't.
Yeah, I'm not at all questioning that.
And that's all I'm saying is...
Yeah, I just want to make sure we understand the direction that we want to take here.
That's what I'm saying.
Trustee McPherson?
Since I've spent most of my summer going over to board policies, to me this is kind of like a blanket policy. It seems to incorporate bits and pieces of many of our policies. It references the character education, and I spent 4 years sitting over in that seat looking at those signs, the same as Trustee. And they are a constant reminder about what we're about. It encompasses part of our anti-bullying policy. It encompasses part of our safety in the workplace policy. I can go on. mentions special education, inclusive education, no matter what your capacities are. So this policy here ties in a great many other policies. And there may be concerns that we have that are actually covered off somewhere else, because that's where the specifics are. This is as much a statement of our intent. And I just wonder how we can get, we've got 100 and some schools plus several workplaces, how we can get a comprehensive snapshot of what is out there. I just wonder if that's within the capacity of the staff.
Well, I'm sure they'll tell us.
Okay,
We'll leave it up to them, and, Associate Director Carson.
Just asking a question for clarification, because I also heard, and maybe I got part of that conversation because I was greeting our staff that were leaving, but there's also a danger in labeling, right? We start to create, and who's in that set and who's not in. So I just want to make sure I have the context right. When we're looking at the idea of saying, what's our current status? I just want to make sure I'm using the right lens. It's not so much to say, what kinds of different groups do we have, i.e. using multicultural? Is it to say, how free from discrimination are our board policies, programs, and practices? So how free from discrimination is the home and school relationship? Is that the lens that we're using as I'm going to these policy 454 pieces? Is that where we're applying the lens, or have I misunderstood what we're assessing for the current state?
I think, if I understand you correctly, Trustee McMillan, you're talking about the way we carry out business. The real way we carry out business.
Okay.
Not the way we state we...
No,
I didn't think so. I just wanted to be, okay.
that's doing nothing more than...
Yeah, but
we're against.
So we're looking at...
I think essentially, how close are we to actually living up to this?
We're making sure that we're discrimination-free on all of these things. Is that fair? Okay. Thank you.
Do a timeline for that? Can we negotiate that?
This is a huge one, folks. I mean, I've come from a board a long time ago, and had a very similar to Jeff emotional appeal about this. And it was so divisive in a community that is absolutely multicultural, multi-everything, and I saw people's careers cut short because of where they stood on these things. I think it's going to take a bit of time. I'm totally with you. I just know this, that when it's easier to ask someone to mark a page differently than ask them to think differently. And I hear you, Trustee, saying, the future we want for this community, how do we shape it and address it, and so forth. And I think it's important if we can find out how we're behaving with other groups. They'll tell us. They tell us by not coming back out. They don't attend meetings. Why do we have in some communities where we have a high multicultural population, the school council is all people who look like me? And those are very important questions to ask, and as Ian's taken this, that's a part of what we're looking at. I think that that's a deep, deep, complicated one. I'm not afraid to take a look at it, but I think we're looking at something that's going to take a year to 18 months.
I'm not asking for, I'm just asking that we follow through and do something to make this take on the importance that it should. And not just a response to the ministry. I think it has to be much more than that. For the sake of all of us, and more importantly, for the sake of our kids.
Yeah. Everybody concur with Trustee McMillan's, or does anyone want to discuss it? Trustee McRae?
And I think as board members, every time a policy, comes forward, if we can always just keep in mind this learning while building a strong sense of caring and respect for all. And that just has to be in the forefront all the time. Every time a policy comes in front of us, we're always thinking in terms of care, respect, character always, and equity and inclusive education.
And through you, Joe, I agree 100%, but those are only words. The words are meaningless unless there's action attached to it. So yes, every time we can write that down in a document, and it becomes in nothing, it's still nothing more than words. And we do a very, very good job of putting into action what we believe. And this is just another step of doing that. And I agree with you 100% that we put those things down. But, you know, to use an old expression, talk is cheap. Actions are what we need to be doing.
Trustee McAllister?
I agree with the policy completely, but I think to follow up on Jeff's point, what this policy means is that we are holding our schools, ourselves, our students, our employees to a higher standard. And we have to demonstrate it and can demonstrate it in terms of our behavior.
Any other comments?
I think this may be appropriate time, Trustee McMillan, through you, the Chair. We have a really powerful credo that all of our staffs go through. I examine 4 times a year with my staff. I think this may be through this process, Ian, is where we are about due to give it a relevance test, and it is a powerful document that has held our feet to the fire. And as Trustee McAllister said, that's how we expect people to act. And so I think this is a time to put it back out there.
Okay. So we're going to send this policy on to the board, and we will work on the report as well.
Scary but exciting.
Do you want to move her and a seconder? Okay. Can I have a mover and a seconder to send this? Trustee Swan, Trustee McMillan? If there's no, I'm assuming there's no opposition, so we'll just assume it's carried, and I think that brings us to the end of our agenda. Thanks, everybody. That was good work. Everybody, that was a good meeting. Chair, that's what I'm doing. And you want to comment too? Well, I'll let you go then.
Well, thank you, and I sort of butt in, but what I wanted to do was, and the coattails on the passion that Trustee McMillan has shown for this one. When I read the newspapers online when I was away on holidays about the walk, I couldn't help but think the courage of these 2 students. I thought it was fabulous that they had the Facebook and all the things that went to organize this, and I was quite shocked in the Brockville that I've come to know that we were able to pull this off, and I just thought it was tremendous that we had 2 of our trustees who put it on the line and walked in the parade. And I just want to say, from my perspective, thank you very much, and I think it acts as a great foundation for what we're going to try and do now. On another note, totally different, I'd like to, and I'll do this somehow through a memo to our letter to the whole system, but we again as a year, we had a tremendous issues going on over the summer. We had 3 of our schools moving through 7 through 12s. We had people working all summer long. I was in each of our new 7 through 12 schools and absolutely amazed at the work that's gone in. IT delivered on all its promises. The operations things were done. When we walked through, Trustee McMillan and I, when we walked through Gananoque, I mean, the custodian had great pride in what he was doing. I think, John, you must have been proud of the whole moment. And you think that all of the work that's gone to this, and then we walked into the different teachers' classrooms, the teachers had their first day lessons up, and you could almost say, gee, I wish I could send my kid there as you go through. But that didn't happen by any fluke, and HR played a huge role in it. People got their checks, are all in new places when they were, and again, another year where the summer was spent doing a great deal of work. And then I guess my last one is, you know, the trustees, I phoned you and bother you, say, is there anything on transportation? And I'm just going to knock on wood right now, because every day, that first day of school, first week of school, I just wait for the barrage of phone calls that come up. You mind a little Sally sat for an hour and a half at the, you know, and so on. And we had a couple. But I must tell you this, when you move the most number of kids and the largest number of kilometers in the province of Ontario, I'm so proud of transportation. I just want to say, before the consortium is totally up and running, they delivered a home run again for us. So to all the groups that work in here, that sometimes their work goes unnoticed, I think, and I speak for the senior team, deeply proud of the attention to detail and the operational excellence. So, Jeremy, please speak to your group and let them know at the table, I said this, IT and operations, and I know that they go through. Everyone got their paychecks, had no complaints, I think, Charlotte, everyone sort of knew where everyone was, and all the teachers arrived at where they're supposed to, and again, in transportation, I think that, Rick, when we're talking to Ron, again, we call him the super manager, but he and Ron was in here earlier, through operations and plant moves, a tremendous thing with the geography we have to cover. It was deeply satisfying to work through a week like that and we did have a couple, but we're moving through them, and I think the parents are realizing that although we're new in customer service, trying to figure it out, I think we're delivering at a high level because there's good spirit about it. So please tell your divisions how they responded, and thank you very much for your hard work.
All right, motion to adjourn. Trustee Garrow, Trustee McPherson, all in favor? All right, quickly across the way then.